Welcome to the next video in the new Employee Benefits Orientation series. In this video, we will cover the health and vision insurance options. As an employee, you are offered several health insurance coverage options. We will cover each one in more detail during this presentation. The health plan options include several HMO choices, several open access plans, the Quality Care Health Plan, and the Consumer-Driven Health Plan. Employees who wish to decline coverage may do so, but must still complete their enrollment. Information regarding premium costs, co-payments, deductibles, and prescription costs can be found in the Benefit Choice booklet. The Benefit Choice booklet can be found on the Benefit Election Resources page of the ISU Human Resources website. There is also a link included in the orientation email you received from us. The first of several options are the Health Maintenance Organizations, or HMOs. The primary difference between the HMOs will be the network of providers and facilities. If you decide to enroll with an HMO, we encourage you to review each plan and its providers to determine which one is the best option for you. Please review the map in the Benefit Choice booklet found on the HR Benefit Election Resources website to confirm plan availability for your area. Members who elect an HMO plan will need to select a primary care physician, or PCP, from a network of participating providers. A PCP can be a family practice, general practice, internal medicine, pediatric, or an OB/GYN physician. The PCP will direct all healthcare services and will make referrals for specialists and hospitalizations. When care and services are coordinated through the PCP, only a copayment will apply. There are no plan year deductible for medical services obtained through an HMO. Preventive care is paid at 100% when services are received through a network provider. If you are someone who travels outside of the area regularly or has a dependent who lives out of the area, we encourage you to review each plan to determine whether it will suit your needs, as HMOs require the use of in-network providers with the exception of emergency situations. Each of the HMOs offers coverage for mental health and substance abuse services. When electing an HMO on the My Benefits portal, you will need to identify a PCP for yourself and any dependent covered by the plan. Aetna requires you to provide the NPI number for the provider you select. This is a 10-digit number that can be found by reviewing in-network providers on the plan's website. The two Blue Cross Blue Shield plans require you to enter the 3-digit facility code associated with your selected provider. This number can also be found by reviewing in-network providers on the plan's website. You can find the website and phone number of each health plan by reviewing the Plan Administrator Contact Information link on the Human Resources New Hire Benefit Orientation page. Further information on specific benefits can be found by reviewing the Benefit Choice booklet found on the Human Resources New Hire Benefit Orientation page. Each HMO offers prescription coverage. You will not receive a separate insurance card to use for prescription benefits. Instead, you will just provide your health insurance card when picking up a prescription. Prescriptions have an annual deductible per enrollee, which resets on the plan year each July 1st. After the deductible has been met, prescriptions are available for copays based on the tier that the drug falls into. Each HMO will have its own qualifying list of drugs to determine the tier and cost of the prescription. Preventive prescriptions are available with no copay. There is also a reduced Tier 1 pharmacy benefit for HMO members. Certain medications are available for a reduced copay when obtained in either a 30 or 90-day supply. Please contact your health plan administrator to learn more about this benefit and which medications apply to the reduced copay. The next type of plan we'll discuss are the Open Access Plans, or OAPs. There are 3 choices for OAPs. You can elect either Aetna OAP, HealthLink OAP, or Blue Cross Blue Shield of Illinois OAP. Just like the HMOs, we encourage you to review each OAP and its provider network to determine which one is the best option for you. The primary difference between the OAPs will be the network of providers and facilities. Open access plans combine similar benefits of an HMO with the coverage offered under a traditional health insurance plan. Members who elect an OAP may choose between 3 tiers of providers when obtaining services. The benefit level is determined by the tier in which the healthcare provider is contracted. Members enrolled in an OAP can mix and match providers and tiers. Preventive care is paid at 100% without having to meet the annual deductible when services are obtained through a Tier 1 or Tier 2 provider. Each OAP offers coverage for mental health and substance abuse services. Tier 1 offers a managed care network, which provides enhanced benefits. Tier 1 benefits require copayments that mirror typical HMO plan copayments, but do not require a plan year deductible. Tier 2 offers another managed care network which provides enhanced benefits in addition to the managed care network offered in Tier 1. Tier 2 requires copayments, coinsurance, and is subject to a plan year deductible per participant, which resets on July 1st each year. Tier 3 covers all providers outside of the managed care networks of Tiers 1 and 2. Using Tier 3 can offer members flexibility in selecting healthcare providers, but involves higher out-of-pocket costs. Tier 3 has a higher plan year deductible per enrollee and has a higher coinsurance amount than Tier 2 services. In addition, certain services such as preventive and wellness care are not covered under Tier 3. Furthermore, members who use out-of-network providers will be responsible for any amount that is over and above the charges allowed by the plan for services, called allowable charges, which could result in much higher out-of-pocket costs. When using out-of-network providers, a member should obtain pre-authorization of benefits to ensure that medical services meet medical necessity criteria and are eligible for benefit coverage. Members who use providers in Tiers 2 and 3 will be responsible for the plan year deductibles. In accordance with the Affordable Care Act, Tier 2 and 3 deductibles will not cross-accumulate, which means that the amounts paid toward the deductible in one tier will not apply toward the deductible in the other tier. It is also important to note that there are not out-of-pocket maximums for Tier 3 services. However, there is a combined out-of-pocket maximum for Tiers 1 and 2 that can be found in the Benefit Choice booklet. Further information on specific benefits for the current plan year can be found by reviewing the Benefit Orientation booklet found on the Human Resources New Hire Benefit Orientation page. Each OAP offers prescription coverage. You will receive a separate prescription card to use when filling a prescription. Regardless of the tier used, an annual prescription deductible applies for each member and dependent, in addition to applicable copayments, coinsurance, and medical deductibles. Each plan will have its own qualifying list of drugs to determine the cost of prescription copay after the deductible has been met. Preventive prescriptions are available with no copay. Prescriptions may be filled at an in-network pharmacy or through the plan's mail order program. OAPs require a mandatory maintenance medication program. If you have a prescription that has been deemed a mandatory maintenance medication, you are required to fill that prescription at an in-network pharmacy or through the CVS Caremark mail order program. Prescriptions filled through this program as a 90-day supply can be received at a reduced copay. The Quality Care Health Plan is the third option available to employees. This plan is administered by Aetna and offers access to a nationwide network of providers. Under the Quality Care Health Plan, members can choose any physician or hospital for medical services. However, they receive enhanced benefits resulting in lower out-of-pocket costs when receiving services from a Quality Care network provider. An annual deductible per participant, which resets on July 1st each year, applies to this plan and varies based upon the member's annual salary. After the deductible has been met, most services are paid at 85% up to an out-of-pocket maximum. When using out-of-network providers, a separate deductible applies and services are paid at 60% of allowable charges. Preventive care is paid at 100% without having to meet the annual deductible per participant when services are obtained through a network provider. Notification to Aetna is required for certain medical services in order to avoid penalties. The Quality Care Health Plan also offers coverage for mental health and substance abuse services. The Quality Care Health Plan offers prescription coverage. You will receive a separate prescription card to use when filling a prescription. An annual prescription deductible applies for each member and dependent, in addition to applicable co-payments, co-insurances, and medical deductibles. The plan has a qualifying list of drugs to determine the cost of the prescription copay after the deductible has been met. Preventive prescriptions are available with no copay. Prescriptions may be filled at an in-network pharmacy or through the plan's mail order program. The Quality Care Health Plan requires a mandatory maintenance medication program. If you have a prescription that has been deemed a mandatory maintenance medication, you are required to fill that prescription at an in-network pharmacy or through the CVS Caremark mail order program. Prescriptions filled through this program as a 90-day supply can be received at a reduced copay. The final health plan available to choose from is the Consumer-Driven Health Plan. This plan is a high-deductible health plan as defined by the IRS. The Consumer-Driven Health Plan is administered through Aetna and has the same network of providers as the Quality Care Health Plan. Under the Consumer-Driven Health Plan, members can choose any physician or hospital for medical services. However, they received enhanced benefits, resulting in lower out-of-pocket costs when receiving services from a network provider. An annual deductible per participant, which resets on July 1st each year, applies to this plan. After the deductible has been met, most services are paid at 90% up to an out-of-pocket maximum. When using out-of-network providers, a separate deductible applies and services are paid at 65% of allowable charges. Preventive care is paid at 100% without having to meet the annual deductible per participant when services are obtained through a network provider. Notification to Aetna is required for certain medical services in order to avoid penalties. The Consumer-Driven Health Plan also offers coverage for mental health and substance abuse services. The Consumer-Driven Health Plan offers prescription coverage. You will receive a separate prescription card to use when filling a prescription in this plan. The plan has a qualifying list of drugs to determine the cost of the prescription. Preventive prescriptions are available with no copay and are not subject to the plan year medical deductible. In addition, other certain prescriptions or supplies that are considered preventive per IRS guidelines are covered at 90% and do not require the medical deductible to be met. Other types of prescriptions are typically covered at 90% after the plan year medical deductible has been met. Prescriptions may be filled at an in-network pharmacy or through the plan's mail order program. The Consumer-Driven Health Plan requires a mandatory maintenance medication program. If you have a prescription that has been deemed a mandatory maintenance medication, you are required to fill that prescription at an in-network pharmacy or through the CVS Caremark mail order program. Prescriptions filled through this program as a 90-day supply can be received at a reduced rate. A benefit is available every 24 months for hearing instruments and related services through all health plans when a hearing care professional prescribes a hearing instrument. Members should contact their insurance plan provider for additional details on this benefit. Vision coverage is provided at no additional cost to members enrolled in any of the health plans. All members have the same vision coverage regardless of the health plan selected. Eye exams and replacement lenses are covered once every 12 months from the last date the exam benefit was used. Standard frames are available once every 24 months from the last date used. Copayments are required for in-network services, and allowances are provided for out-of-network services. The plan administrator for the vision benefit is EyeMed. You may visit in or out-of-network providers with EyeMed, but will usually have lower out-of-pocket costs when visiting an in-network provider. This completes the Health and Vision video in the new Employee Benefit Orientation series. Please continue to the next video to learn more about the benefits available to you.